So welcome everybody to our first ever virtual edition of East County Movers, Shakers, and Newsmakers. Today we're very honored to have two super special guests with us. Dr. Tseng, who is sort of our local version of Dr. Fauci. He's going to tell you everything you need to know about COVID. And then we have Robyn Herrick, who's actually going to go first today. Robyn is the Community Resiliency Advisor and Coordinator for San Diego Gas and Electric Company. She's got a family wedding tomorrow, so we're letting her go first. Congratulations to you.
Oh, thank you.
And now in the past, SDG&E has held their wildfire safety fairs across East County, and these were super popular events. And now during the pandemic, they've adapted by providing drive-through safety fairs, with 3 more coming up that you can attend. Learn how to protect yourself and your family from wildfires and get a backpack full of some super cool and free preparedness items. Robyn, can you start by telling us when and where your next wildfire drive-through safety fairs will be held?
Sure. The next one we have is Saturday, August 22nd at Bates Nut Farm in Valley Center. Start time is 10 a.m. to about noon. The next one after that would be September 12th, which is Mountain Empire High School, same time, 10 to 12. And then the last one is the Alpine location, which is the east parking lot of Viejas Casino on September 26th, 10 a.m. to noon.
Very good. I just checked my Facebook page and it does not look like this thing is live streaming. It says that it is, but if anybody's on Facebook and can see this thing, would you email me, please, or let us know? Because it says it's live streaming, but I didn't see it on my page. So we'll have to work the bug. We may have some bugs to work out, but if you're trying to listen and can't, we're going to be putting a tape up also on the Facebook page and on our homepage. So Robyn, how do the wildfire safety fairs work, and what safety rules are in place due to COVID-19 for those who might be concerned?
Sure. So this year, of course, it's a drive-through event. What we're doing is we are setting up our booths every 6+ feet apart. Each participating group or department will have masks, gloves, as well as we have hand sanitizer stations. And we've also asked the communities when they come in to go ahead and wear a mask also, so that everybody feels protected. And it's just a quick drive through. We've got about 14 booths, and come through, ask your questions. We'll answer them as quickly as we can. But we've got a couple of SDG&E departments there. We'll have our partners, 211 San Diego, Calif, San Diego County Fire Authority, Feeding San Diego, and a bunch of really great information. But again, we just ask that you drive through. Each department or each participating agency will be handing out information as well as some really great goodies. And then they'll also have their contact information, so that if you have a lot of questions, you can have that means to contact them at a later date, so that we could have all the cars flow through in that 2-hour window that we have.
That's fantastic. And you don't even have to get out of your car, folks. You literally just drive up to the booth. So it's really cool. What else can people expect to learn? And can you tell us about the backpacks you've got full of goodies that everybody gets, or each vehicle gets?
Sure. So first, when you come in, you'll get a little welcome card with a directory to let you know what partners and agencies, as well as departments with SDG&E are there. So you can kind of gather your information. The next booth is going to be a kettle corn popcorn with some cold drinks. So as you cruise through our event, you have something to snack on. And then we have like our vegetation management. They're giving away trees for Right Tree, Right Place. We have our major projects group for some of our strategic underground and backcountry work that's going on. We have our group, Fire Science and Climate Adaptation, and we've got these great backpacks. I've got one here. It's got all your basics of toiletries and first aid in there, as well as some water bags. And then we're also this year adding a solar rechargeable solar pack, so you can throw it out in the sun during the day, and at nighttime, if you need to charge, you can. An inverter that plugs into your vehicle cigarette lighter so that you can charge your cell phones, plug in your laptops, whatever you might need, as well as this really great emergency radio. It charges 4 different ways: solar, battery charging,
Wow.
as well as crank.
So you're
So
covered no matter what.
yeah, we've got a lot of great information in there.
You know, and I'd like to say that I think it's more important than ever this year during the pandemic for people to really be prepared for an evacuation if it happens, because they have new rules for setting up evacuation centers where they have to have medical personnel on hand to screen everybody for COVID, for temperature first. Psychiatric professionals have to be on hand. I'm not sure why that is. But at any rate, and they have to have social distancing, which means there's a lot fewer facilities. So it might take a little longer, I'm guessing, to get these open, especially in the back country, that, where it takes a while to maybe get a doctor out there. So you should be prepared with your own communications, your own, enough water to drink and supplies. And I think there's everything, including toilet paper in this kit. So it's just a good idea to be extra ready and come on out. Can you tell us one more time where those are going to be, Robyn?
Great. Again, Bates Nut Farm in Valley Center on Saturday, August 22nd. Mountain Empire High School, September 12th. And VA House Casino East Parking Lot in Alpine, September 26th. All are from 10 a.m. to noon. And we've got some great information, some great giveaways. And we hope to see everybody there, and I appreciate it.
Yeah, that's wonderful. Also, SDG&E, a lot of people don't know, they've got this network of weather monitoring stations now, and sometimes they're the first with their cameras to identify the fires. They've even got a firefighting team now. But despite all these efforts, sometimes there are outages, either planned to prevent a fire, if it's really windy, or unplanned ones. So how can people sign up, Robyn, to get notifications if you know of a planned outage, or, and also if somebody has specific needs, maybe they're on medical equipment or something, they're particularly vulnerable, what can you do for those folks now? That's
so
new.
anybody can go to sdg.com/weather wildfire safety. And you can set up for alerts. You don't necessarily have to be an account holder any longer. This year, you actually, if you are a non-account holder, and if you have a parent or somebody living in the backcountry, you can sign up for alerts off of their circuit so that you can get notified also. So anybody could get notified on a public safety power shutoff, or things that are going on in the communities that you're interested in knowing.
Very good. Well, Robyn, thank you so much for taking the time to join us. We hope you enjoy your niece's wedding. And again, congratulations and thanks for sharing.
Thank you very much.
Okay. So moving on, we're going to introduce Dr. William Singh, Dr. Singh now. Hang on, just give me a second here. Before we do that, I just want to give a little backdrop here on the latest COVID situation worldwide. And John, this might be a good time, I'm talking to our producer here, to put up that chart showing how we're doing in San Diego compared to California, the United States, and the whole rest of the world. So nationally, right now, the US has the most COVID cases in the whole world. Over, almost a quarter of them all, maybe more than that. We in California have seen cases spike after a lot of the businesses started reopening, so we've seen some new shutdowns. Now, our county is still on the state's watch list, which means that schools and businesses cannot reopen until we improve a couple of things. Now, the good news is 2 days ago, we were on the watch list for 3 metrics. As of today, it's down to 2. They finally got the, looks like the, hiring enough case investigators, so we're getting the cases investigated a lot faster. So that's the good news. On case rate, to get off the watch list, we have to have 2 straight weeks with 240 or fewer cases per 100,000 people, and we're getting closer on that. We're not quite there. The big problem is the community outbreaks. We are not even close on this one. We have to have 6 or fewer outbreaks over 7 days. The last 7 days, we've had 31. So that's more than 5 times the number that we need to do. Recent outbreaks have included restaurants, a preschool, a college, gyms, offices, private gatherings, all kinds of things. The county is cracking down on violators, so be careful out there. They just issued the first criminal charges against a Ramona gym owner who was defying the public health orders and keeping his gym open indoors. So we're doing better on some things, not on some other things, but without further ado, I would like to introduce Dr. William Tseng, who is an internal medicine physician with Kaiser Permanente San Diego, where he also serves as the assistant area medical director, a physician ambassador to the corporate community, and oversees Kaiser's Diversity Council. He's a trustee for the California Medical Association, and he serves on the executive board of the San Diego Medical Society. He has his master's in public health from Johns Hopkins University, great school, but one of the best in the country. My daughter interned there. And he also completed his residency there. He's a voluntary faculty member at UC San Diego's School of Medicine, and he's been actively involved in Doctors of the World, also working with the San Diego County Medical Foundation to develop a program of volunteer physicians to treat low-income uninsured patients. Welcome, Dr. Tseng, who is basically our local version of Dr. Fauci.
Thank you very much. Thanks for having me.
So I guess the question on everybody's mind is, what do we really need to do to get these community outbreaks under control and get off the state watch list?
You know, if it's okay, give me a couple minutes to describe how we got to this state. I'm just going to quickly in a couple minutes describe what happened and how things started.
Excellent.
So let's start and remember back to Valentine's Day, February 14th of 2020, this year. San Diego County actually declared a state of emergency. So our county jumped on this very, very early. And the reason we did that was because there were expatriates from the US who were living in China. As you remember, they flew them over to the military base. And we knew that if we didn't do something, if we didn't start thinking about this, this will be an issue. So we declared it faster before anybody else did. So then in March, we started to see community cases. So no longer are they being transported to our county. They're actually community cases.
Correct.
We warned people and people started hunkering down. March 4th, Governor Newsom declares a state of emergency. March 12th, a week later, our own mayor, Faulkner, declares an emergency for the city. And then March 13th, the president then issues a state of emergency. We closed down the whole place. Everybody hunkered down like they should. And through March and April, we started seeing cases go up. And then about April to May, we started seeing things flatten out. We were very, very excited at that time. And a lot of us who follow this very closely, we're very excited because we thought maybe the summer, maybe it's a seasonal thing. Maybe it'll go away during the summer, just like the flu. Maybe that's the case. And then May 25th, that's when Memorial Day happened. And we were still worried, but I don't think we were cautious enough.
Yeah, we had those people going to the beach, crowding into everything, bars.
Yep. And likely 2-3 weeks later, June 10th, we started to see the cases jump again. And then a week after June 10th, we started seeing the hospital and the ICU rates go up as well. So it's predictable. Once we see it, we can see where the pattern's going.
I should add, we saw another spike after the 4th of July weekend. Same thing.
That's
People didn't
right.
learn.
That's right. 4th of July, also same thing. We're seeing that spike. So, you know, in a matter of 2 weeks, we actually we wiped out all the gains that we did in April and May, just in a matter of 2 weeks. And right now we're higher than we've ever been in terms of that number. But the good news is we are starting to see a little bit of that flattening. And because of this jump through end of June and July 1st, the bars were closed. July 15th, the indoor activities were closed. And this is, so 2 weeks after that, July 24th, this is where we're starting to see a little bit of leveling off.
So basically, even though it's unpopular to close a lot of these things everyone loves going to, it's working.
It's working, yeah. So it is working. And as much as we hate it, and here's the part, we definitely need to be aware that the economy is being affected and people's lives are being affected. But where to find a balance, that's the toughest part. You know, we can give as much of the medical advice as we can, but we have to balance the realities of life. And that's the tough part. Where is the right balance? And, you know, our county officials are working very hard. You know, you showed those numbers, which are very interesting. in terms of the world, what we do is we look at the number of people who died and the number of people who contracted the disease, and we call something called case fatality rate. Out of all these cases, how many people die? For the US, for the world, it's about 3.7% at this moment. For the US, it's 3.26%. For San Diego, it's only 1.8. Because we are
Wow.
working very hard.
Hold
all
that thought. We're
together.
going to get into that and find out what are you doctors doing in San Diego
Sure.
that is working so well. So,
Sure.
but first I have to ask,
Mhm.
why is the US doing so badly in terms of not the death rate so much, but the number of cases? Why is it that we're by far the highest in the world, so bad that we're banned from even traveling now? Almost every country in the world has said, we don't want Americans coming in. So if we want to go be able to take vacations again, what is it that the US has done wrong that should change in your view?
I think there's twofold. One is definitely a supply chain issue. Early on during the pandemic, it was very tough to get supplies. So, the long, everybody knows now how long the swab is. That swab initially was made in Italy. And at the time of the onset, we didn't have enough swabs because they were made in Italy where they were having the pandemic.
Mm-hmm.
And then now it's moved on to the reagents. There are some reagents where the supply chain has become an issue. We're not able to get them all. So the testing is an issue. Now, more than the testing, the strategic part of it, I think is got to be, cannot be understated. We need to have a good testing strategy, and we need to have availability of testing. We're getting better because at the very beginning, we were only testing symptomatic inpatients, but every week we're broadening that to more and more. And now we're testing all the symptomatic patients as much as we
Yeah.
can, and we continue to broaden.
Now, we saw a lot of other countries that did national lockdowns early on, and now they're reopened and they're doing a lot better. Do you think there's been a problem, in terms of not having a national strategy for this?
Yeah, and also the mixed messaging doesn't help. If we're going to function as a country, we need to function as one. I mean, the masking issue is one that keeps coming to mind. Really, it's really out of respect for your neighbors, your elderly, your children, to make sure that you don't spread the disease. By wearing that mask, you essentially decreased in transmission from a high risk transmission to a medium and even low risk if you're wearing eye shield as well. So if we can even just get people to wear masks, not for any political, it's not a political issue.
I was going to ask, what would you say to those who say, either it's a hoax, it infringes my freedom, I can't breathe as well with it? What's your message to those folks?
When it comes to public health, it doesn't matter what side you're on. It will transmit to anybody, anywhere it can. In terms of freedom, we do have a lot of public health issues. We have public toilets, public bathroom, public facilities, public statutes that we should abide by. And if we don't, outbreaks will occur, like hepatitis can occur. There's a lot of infectious disease issues that really is not a political issue. And again, we want everybody to be part of the solution rather than being part of the vector. Wear a mask, protect other people, protect your neighbors. It's not just about you. Yes, you can get protected as well, but most of it is we can stop the transmission. We can help. We got to be part of the solution here.
So back to the solution. I'm intrigued by the fact that San Diego's death rate is so much lower than anywhere else. What are the reasons? What have you learned since the pandemic began about the most promising treatments to reduce the severity of this coronavirus? And what's working best? Have we maybe tried some that turned out not to be so great? What can you tell us about that, given that we still don't have a cure and a vaccine is probably not going to happen until maybe next year, although there is, viewers, about 30,000 people going through a trial, actually 2 different trials, each with 30,000. So hopefully there is an end in sight once there's a vaccine and enough people have it. But for now, what are the most promising treatments, and how are you keeping people off those ventilators or worse, from dying?
Right. At the very beginning of the disease, we really didn't have much. And I'll just kind of give you one example of my patient. one of the earliest patients that I saw, and I've never seen this in my life. Normal saturation should be around 93, 94% minimum. And this young guy walks into the hospital with his saturation rate in the 70 percentile. And usually if you're 70 percentile, you are unconscious on the bed. You're not responding. And this guy is just talking to me.
And we're talking about your breathing, your oxygen saturation.
Yes, your oxygen level. So I've never seen something like that happen. We treated him, we got him what he needed. And also the rate of deterioration is a matter of hours, not days. So at that time when we started, we just had supportive care. We had him intubate. We could do as much as we possibly can for him. But all we had at that time was oxygen, IV, supportive care, and treating any errors that we can find. But as we've learned now, we can also start using high flow oxygen. We have O2 maximizers, non-rebreathers now. We even use BiPAP nows with viral filters before having to put them on a ventilator. We've also learned that proning is very helpful. And proning, for those who don't know, is essentially flipping, from laying back to laying on your belly. Because we know that most of the lung is toward the back of you. So when you lay toward your belly, you open up the airways, and that allows more oxygen in, and you get better oxygenation.
Now, what about some of the different drugs that have been tried and are being used?
So in the beginning, the hydroxychloroquine and azithromycin combo, not so good now.
That's the malaria drug,
Yes, we tried those, and we stopped them as soon as the studies showed that it wasn't helpful and maybe even harmful. We have
dangerous for those with heart conditions, I know.
Yes, you can get some arrhythmia. So we had those as well. But again, we were trying everything we can to make sure that people get better. Now we have remdesivir, which is an antiviral drug that Dr. Fauci has talked about. We have steroids. We put people on blood thinners now because we know clotting is such an issue. And we also have convalescent plasma. And for those who don't know, convalescent plasma is basically antibodies that you develop. So for those who have COVID, they get over the COVID, about 30 days later, they build up these antibodies. What we ask people, if you have COVID, is go to the Red Cross. Please donate the plasma. What they can do is take out that antibody and give it to a patient who's really ill. We have seen
save lives,
Yes, we have seen some lives saved because of it.
And is this easy? It's like giving blood. It's not like something really invasive, right?
No, it's just like that. It's a little different process, but it's just as easy as giving blood. Maybe longer, where they take out the antibodies. But again, it is life-saving. We have a lot of anecdotal evidence right now. There are studies ongoing to look for benefits, but this is one way that if you've had COVID, you can help save another life. And we're hoping that anybody who's had COVID will do that.
Yeah. Now, we've heard a lot about, the higher risk to older folks and those with pre-existing conditions who are most apt to wind up on those ventilators or not making it. But we haven't heard as much about the long-term impacts of people who survive COVID-19 and recover. What percentage would you say are winding up with long-term or serious health problems, including, you mentioned the blood clotting issue, by the way, and strokes and things?
Right. We've only had about 3 to 4 months good experience with this, so that we don't know exactly what the long-term outcome is going to be. However, we definitely know that in severe infections where you need a ventilator support, you will get scarring. There are damage that are lifelong and
brain damage sometimes, and
if you have strokes associated with it, or some other injury associated with the disease, sepsis as well. Where the infection takes over the body, those can lead to permanent damage. Again, we just don't have enough time and experience to be able to document the long-term effect. But
and the clotting, to be clear, that's not because of a ventilator, unlike some of the other breathing issues, but the clotting is specific to COVID, where it fills up the tubes even with blood clots.
Yes, there is an increase in inflammatory markers that we definitely see with this disease. And because of that, in a lot of the patients, we put them on blood thinners even as they go home. And there's even some studies now talking about possibly inhaled heparin, which is a blood thinner, to prevent clots. These are all, again, they're not conclusive yet, but these are a lot of things that we're talking about. We even talked about nitrous oxide, breathing, using nitrous oxide to help
Oh, wow.
get the oxygen into the lungs. So there's a
So there's a
lot
lot of
of
experimenting going on as well as to what works. And we're
Right.
lucky to be in San Diego where this is going on.
We are.
Now, a lot of people have asked me about if they've tested positive for COVID or they've been exposed and they're quarantining at home, what are things they can do that'll help kind of increase their odds there? Should they be taking an anti-inflammatory or any kind of, vitamin C or turmeric, all the different things we hear? What do you
Yeah,
think?
you've got to always risk the risk and benefits of medication, because you can be taking anti-inflammatories, but that can also cause ulcers as well. So right now we don't have anything definitive. I mean, there's anecdotal evidence with zinc and vitamin D, but there again isn't anything definitive that we can say, if you take this, you really will decrease your risk. What we say is, if you do have COVID, you've got to let us know. If your fever is above 100.5 for more than 3 days, you've got to call us, at least let us know and keep us up to date on things. If your respiration gets worse, meaning if your breathing starts to get fast, that's something that we should know about. Headaches, worsened fatigue, general malaise, a lot of the symptoms. It's very easy to see us. In fact, we encourage you to give us a call. A lot of visits can be virtual, and we've done everything we can, bend over backwards, to allow access. In fact, we've increased our telephone access by up to 80% at one point. And
Very
we'll
good.
even come out to give you your medications for drive-through medication. We'll do whatever
Yeah.
we can to get
Now,
you the service you need.
you've mentioned a device that people can get and keep at home that measures the oxygen. It pinches the finger and measures the oxygen levels. That's a good thing for people to have, at least if you've been exposed or have COVID. And you've also mentioned there's a specific level where if it shows a certain level, you should be getting yourself to a hospital immediately. Can you elaborate?
Yeah, so that's called an oxygen saturation monitor. What we do is we have a COVID kit that when you get discharged from the hospital with COVID and you fit that criteria, then what we do is we send you home with a kit that has thermometers, a pill box, a oxygen saturation monitor, some gloves and hand hygiene equipment to try to get you prepared. And we're going to be coming up with a outpatient version pretty soon. But the idea is, with that saturation monitor, if you put it on, you can see how your body is doing in terms of getting enough oxygen. Is the oxygen you breathe in getting delivered out to your fingers, your toes, your brain, the rest of your body, your kidneys? And that saturation monitor, if it drops to the like the high 80s or even low 90s, it's something that gives us an early warning. So I would call us back to let us know, so we can make that clinical judgment for you and determine what's safe. We do not want you to avoid coming to the hospital, because I can tell you, in our Kaiser Hospital, we have not had and thank goodness, we have not had a hospital case transmission of COVID from patient to staff or staff to patient. So we are very, very serious about masking. We're very serious about wearing shields, hand hygiene, and social distancing.
That's fantastic. So people shouldn't avoid going to their doctor, especially if they're sick, or for their preventive care for that matter, because it really is pretty safe. It's safer than going to the grocery store statistically. We have a reader question here I'm going to throw in. Someone emailed in or viewer question, and they wanted to know about those plastic face shields. Are they as safe as masks? And if not, should the guidelines be changed maybe to say not facial covering, but mask?
Well, the best combination is really wearing a mask and a face shield. That automatically reduces your risk from high to medium and then all the way down to low. So we use a combination. So if I'm seeing a patient, you'll always see me wear a mask and a face shield on. So I would be for the face shield. Again,
But not instead of the mask.
Not instead of the mask,
Okay,
yeah.
got it. Got it. How reliable now and how fast are the COVID tests that we're seeing in our area? I know John just went through this. He
If you
was
don't mind,
exposed. It took a while to get the result.
if you don't mind, I'm going to go back a little bit on your last question.
Go
The
ahead.
face shields don't have to be just face shield. They could be just glasses that cover the side as well. So it could be just a mask and glasses that cover just the side of your face as well. That would suffice in
For
dropping.
goggles, yeah.
Yeah. So
That
I'm sorry.
helps.
And your question?
How reliable are the results of the COVID-19 tests, and do we have enough of them now? And are we getting results fast enough? I'm kind of throwing all the test questions in here at once, and also the antibody tests.
Sure.
Is there a reliable one of those yet?
Sure. So we have actually now 3 different types of tests, and I'm going to go through the main test first. So the
Okay.
tests that you get in the hospital, those are called PCR tests. They basically take a nasal swab, they amplify it, or some saliva, they amplify that, and then they test for the viral particles. Now, there's the antibody testing, and remember the antibody testing is done after you have COVID and about at least 30 days so that we can get an accurate result. And that test to see, have you developed antibodies for COVID? The third one that people will start talking about is the antigen testing. And that's something where you can do it at home, you can do it at different places. So in terms of accuracy, the PCR test and the antibody test are very accurate, depending on the company that you use.
That's the big if. How does the average person know if you're going to go, you want to get one of these? How do you know if it's accurate or not?
With every test, if you flip it around, they should be able, or in the packet, they should tell you what the sensitivity and specificity of the test is. And so it's really, that gives you an idea of how good your result's going to be.
Okay.
If the sensitivity is below 90%, I would say, it's not good enough.
Got it.
Ours is in the 90 to 95 percentile, up to 99.6.
I know there's been a shortage. Are the results coming in fast enough, or when we had spikes, do the labs get overwhelmed? Is that improving?
So different areas have different turnaround times. So within our hospital, we've got several different tests with different turnaround times. There's a rapid test, there's a 24-hour test, and then there's one that comes between 3 to 5 days. I know there are some areas or some facilities that also have trouble where the turnaround time can be up to 10 days. And to me, that really doesn't get you the answer you want, because the virus will be gone by about 14 days.
No, it's useless.
Yeah, so I can just tell you what we have, but I know there've been issues in turnaround times with other facilities.
Okay. Are you seeing in your practice disproportionate levels of COVID in any of the communities, the ethnic or racial groups? We know sometimes, poor folks tend to live in more crowded conditions. They're more apt to be frontline workers where there's more chance of exposure. And how can we reduce any of the disparities?
The question really is there a race issue to the virus? Does it attack a race in different speeds, or is it a health equity issue, meaning different groups have different level of health wellness? And that's a different one to tease out. Right now, we definitely know that the Hispanic population has a higher incidence of COVID, and I believe I think in terms of it's like 61% Latino, 24%.
Which is like double their percentage of the population. So there's definitely something wrong.
But what we haven't 100% conclusively defined is, does this virus attack races differently? At this point, I think equity issue is one that we're looking at very carefully, but also that takes into account the prevalence rate within each community. So it does direct us differently on how to get to the cases as much as possible, as quickly as possible.
I'm curious, one of my readers wants to know about East County specifically. I know El Cajon is a hot spot for it, but the rural areas where they're all shut down, and you've got places like Borrego Springs where it's not real practical to move a business outside when it's 115 degrees out there. You can't really do a gym outside or something. Um, are there areas where the rates are low enough in some of these places where maybe the rules on that balance with businesses should be rethought, do you think? Or
There's no, this thing is going to continue to spread unless we hunker down. So there really isn't a safe place. It's more a safe behavior that will lead to the result we want, rather than moving around. So, initially, Imperial County was not an issue. Imperial County was an issue just a couple weeks ago. In fact, we even had patients transfer from Imperial County because their hospital was.
yeah, one of my readers want to know, is that still being done? Are we still taking everybody else's COVID patients?
Well,
They're too crowded.
we haven't had to, because actually the federals came in, took over, also had some facility sites up and going. So we're doing much better. We haven't had any transfer from Imperial County for at least a week now. We know that has moved up to Central Valley as well. Imperial, not Imperial, but that's the next hot spot. I know Fontana's and the desert area is also a hot spot. The numbers there are still high, but this virus will move around any place it can. It does not take boundaries. It doesn't take political sides. It doesn't take races. It really will attack unless we all work together in trying to limit the spread and be a source control.
Got it. Let's talk a little bit about ages here. One of the new trends we're seeing is a whole lot more young people. I saw some phenomenal figures. I was just looking for them here, but on the county side as of today, it's just an incredible increase in the number of young people that are getting this. Not that they're suddenly more vulnerable than the old people, but they're just not staying home, maybe not social distancing, I think. What advice would you give to the young people? And is it really safer for them? We hear that, they're less apt to get it or get a severe case, but their numbers are definitely spiking way up now. So apparently that's not completely true.
They are. And I'll just give you, yesterday I was in the ER and I was seeing patients as well. And I had a 20-some-year-old who came in with COVID. He was doing the same thing. He was breathing fast. His saturations were lower than it should be. So it doesn't, young people may be healthier. So they may feel it less, but they can also die from this. They can also be in the hospital. They can also be in the intensive care unit. Their mortality rate is lower. There's no doubt about that. And kids in general, meaning younger than 12, really suffer minimal in terms of case fatality rate. But it doesn't discriminate who that 4% or 5% that's going to end up in the ICU.
They can also, one of my readers wanted to know, can children be carriers if they catch it at school and they don't develop symptoms? How risky is it for others in their household?
Yes, they can definitely catch this thing. It definitely spreads. We've seen that example. There's a lot of national examples where kids can spread it to each other.
Even if they don't have symptoms, then.
Even if they don't have, absolutely, even if they don't have symptoms. The concern is once they get it, they can spread it to the parents, that can spread it to the elderly, and that's where the mortality can come. And an 80-year-old mortality still, even in San Diego, is like 40-some%. I mean, it's high for people.
40-something% if you're 80 and you get this. So listen to that. If you don't want to get, kill grandma, pay attention to this. I mean, it really is dangerous. And even for people who are maybe 65 or 70, it's still quite high.
Yeah, for 60 to 69, it's about 18%. For San Diego, this is San Diego.
18%.
Yep. So, yeah, this is a serious issue. This is a serious pandemic.
No, exactly. And the overall mortality rate for this, I want to go over that one more time because it's important. A lot of people are misinformed and saying this really isn't any worse than the flu. What's the mortality rate for the flu compared to COVID-19?
So mortality for the flu should be less than 1%. About 1% is where we quote it.
And what rate is the flu mortality for older folks? If you're 80 and you get the flu, what's your mortality rate?
I don't have that off the top of my head, so I'm not quite clear, but the overall. So I think we can use that number to compare to the national mortality rate or case fatality, which was 3.2%. So
it's more than triple
Yeah,
the
if
death
not,
rate from this is more than triple the
and
flu.
flu is less than 1%. So, it
Right. I
could
think it's
be,
point.
it's more than, yeah. So
It might be 5 or 6 or 7% higher. And then as you get into those old range, some of the higher age ranges, it might be, 15 or 20% or more. It might be substantially more. So be careful out there. Now, flu season is coming up. I would like to ask, how important is it for people to maybe consider getting a flu shot this season? How might flu affect somebody with COVID-19? And one of my viewers wanted to know, how do you tell when flu season comes the difference between flu symptoms and COVID-19?
I don't, it's going to be very tough. That's a very good question. There are some things that differentiate the flu from COVID-19, and that's the things like smell, lack of smell. So there may be some things, but in general, I don't think you're going to be able to tell. So we really have to be careful. We are already thinking, we've actually had our meeting in terms of flu preparedness. And one thing that we've saw is that in Australia right now, and we look at Australia because they're in wintertime now, when we're in summer, they're in a different hemisphere. And usually when Australia has a bad flu season, we have a bad flu season. For right now, it seems like Australia is doing fairly well with low numbers for the flu. They still have the COVID or SARS, but they don't have the flu as much. So we're hoping that it'll translate here, but hope is not a strategy. The strategy is really to make sure that everybody gets vaccinated. And we're going to do everything we can to reach out to people, to ask them to be vaccinated. Because the worst thing you can happen is have two things going on at once. It's called comorbidity, and your mortality rate will go up if you have both flu and COVID.
Yeah, so getting vaccinated for flu is important. Now, what about when there is a flu, a COVID-19 vaccine available, hopefully maybe sometime early next year? How confident are you that once it's released, that it will have gone through all the safety steps? I know some people are concerned about that. And are you planning to get one when it's available? You're probably high risk there, working around COVID patients all the time.
Yes, I'll say I'm definitely going to be going for the vaccine. The vaccine, there is several trials. One is the Moderna trial that Kaiser has participated with in Seattle. And looks like the antibody development rate is as high as somebody who's had the infection. So there's some good results, but the initial studies are all about safety studies. They're actually less about efficacy, but more about, is this safe to try on test out and develop further? And it seems like they are. And there's many different ones going on at this time. So I am very hopeful. I know this has been moved at a much faster pace than I've ever seen it. But we're going to be looking at the data just to make sure that they've done all their due diligence so that this is something that can be given to our patients and delivered in a safe manner. So, it's not conclusive yet, and we're not saying yes yet, but so far the data in terms of safety looks good. Now let's look for the evidence. Now let's look to make sure that this is something that we want to use, but we will be watching it very carefully.
One of my listeners wanted us to touch on this issue of, some of our most highly respected public health officials, Dr. Wooten, Dr. Fauci, have been receiving death threats for, calling for, these very sort of sensible health steps, sensible from a health standpoint, because people view it as infringing their freedom, or they're worried about their businesses and their livelihoods. Have you had anything like that? And also in your practice, are you having issues of a lot of confrontational patients who just don't want to do these things? And how do you handle that as a healthcare professional if it's happened?
I think a couple weeks ago, my daughter pulled up a Twitter account. And look, I didn't look at it. She was saying how my masking stance is getting some people upset. But I think all I can do is do what I know best, which is science. Just trust the science and deliver the science. I want to say I sincerely understand the damage that we've done, that we're doing to our economy. And so in response, I tell all my colleagues, go shopping online, go buy food from your neighbors, go do what you can. And we do go out. I tell my wife, hey, let's support this business right now. Let's shop something, get food at nighttime from them.
Yeah, and this
Anything
would
we
be a good
can to
time for me
help.
to mention, folks, by the way, that on our site, we actually have a local restaurant directory and a local farms directory. And both of those have lists of places that have curbside service. Some of them have home delivery services. You know, in other words, basically no contact or minimal contact. So if you're concerned about that, you don't have to go dine at the restaurant, although a lot of them are moving outdoors and have outdoor dining now, as a few other businesses are doing too.
Yeah, I think this is the time to support each other.
Mm-hmm.
But going back to your question, all I can do is deliver the best science that we know, and we know these things help, these things work. So if we all participate and did that, we're going to reduce it. We can do this. We can do this, but we can only do this together.
Yeah, exactly. Another one of our listeners, viewers, we're doing both radio and video here. So why is it safe to fly on a plane, or, you know, they're allowed to fly people on planes without the social distancing necessarily, but not to be inside a church or in a restaurant? Is one safer or more dangerous, or maybe you think there should be more restrictions on the flying? What are your views on the equitableness of targeting some businesses and not others?
So I'm gonna, again, I'll go back to the science part. If you wear a mask, if you have an eye shield or glasses with side protection, and you leave yourself 6 feet distance, you've dropped your risk from
Correct.
High to low risk. And the other component,
which you can't do on a plane now. Some of them are allowing that, but some of them are now sticking people back in middle seats. So, you know,
so, yeah,
would you fly on a plane like that?
Right. I would think twice, and what I would say is that it doesn't matter what the gathering is, whether it's a large church group, whether it's a march, whether it's, you know, if you maintain the appropriate distancing, hand hygiene, social distancings with mask and shield, you can drop your risk. I think that's where, as much as my science can go, it's hard for me to pick out the plane versus. I think stick to the science, stick to what works, stick to. I think that's where I would recommend.
Very good. Where are the best sources for people to get accurate information?
The CDC website is quite amazing. Maybe it's a little too on the nerdy side, but it has every single detail that you ever need. Kaiser has a wonderful website as well. We have a lot of the FAQs that you have. We actually text out information to our members as well. But you can go to the website. The county has a good website, and the medical society has a good website as well. So
yeah, and here's a shout out for our site too. I really want to thank the Facebook Journalism Project. John, maybe you can put that image up if you're there, John. Anyway, we want to thank the Facebook Journalism Project for helping to support funding these local efforts of ours, and including the online presentations that we're now doing, these virtual presentations. And we've also created a COVID-19 local resource center, which you can find at eastcountymagazine.org. I want to thank the Grossmont Healthcare District for funding that initially, and then the Facebook Journalism Project for funding the expansion of that. It's being updated all the time, all kinds of resources. You may find grants, loans, you know, where you can get help with your utility bills, your insurance. I know El Cajon is doing some help for renters. The city of San Diego just did something like that. And the county has a program, a brand new one, that businesses and nonprofits can apply for actual, you know, relief payments. And I'll toot our own horn a little on this one. We did an investigation into that project, and we found out that initially they probably borrowed some, you know, qualification list from the feds, but initially it said you had to show a copy of your business license. Well, guess what? They don't issue business licenses anymore in the unincorporated part of the county, which meant no local businesses in East County, other than the ones in cities, would have qualified. So they changed that when we brought that to the attention of Supervisor Diane Jacobs' office. And they also eased up the rules for nonprofits, because I pointed out that asking for proof of payroll would eliminate any nonprofits that rely on volunteers, and they're still impacted and, you know, still have bills to pay and can't do their fundraising. We've been impacted by that as well. And if people want to help support our reporting, you can certainly go to eastcountymagazine.org and consider a donation. We'll be forever grateful for that. So Dr. Singh, I really want to thank you for being here. I wonder if you can give us what you view as our best case scenario. You know, we're 4 months into this pandemic or so here in San Diego. As you noted, we started out doing really well, then it spiked, then it's plateaued, then it's starting to go down. We're not quite off the watch list for the state yet, though. How good can it get here, given that the genie is kind of out of the bottle with this? And what will it take to get us there and to reduce our COVID-19 numbers as much as is possible to do right here in San Diego County?
You know, we can do this. I know we can do this, but we've got to, again, do it together. If we all follow the guidelines in terms of how to prevent the spread, masking, shield, hand washing, social distancing, we can do this. Now, what we need to do is get over the wintertime. If it's a low flu season and we manage to contain our COVID spread, I think by the time next year, early next year, when the vaccine comes out, we will have a better handle on this. The testing needs to increase, and we're continuing to do that. So once we get the testing done, the tracing done, and with the treatment, which is the medications that we're all developing, with that combination, we can get over this. It's not going to be easy because the effects are delayed, but we can do this. And I'm hoping by next year, sometime next year, we will have a much better handle on this. But to get us from here to the vaccine, we all have to work together.
Very good. Are you seeing my the image I just put up now of the thanks to the Facebook Journalism Project?
Yes, I do.
Very good. I really want to just acknowledge and thank our entire reporting team. It's very exciting. We've been able to assemble some super professional journalists with just collectively probably hundreds of years of experience in the field, and they've been out there documenting all of the impacts across our communities, the diverse communities of East County. And so you can go to eastcountymagazine.org. You can click on our Facebook Journalism Project, and you'll see not only all the health reporting we've been doing on COVID-19, but some of the other emergency and critical issues coverage that we've had on a variety of things. So I'm going to stop the share now and come back to being me. And I just want to really thank everybody who's watching today, and definitely thank our speakers. And Dr. Singh, do you have any parting words that you would like to share with folks today?
No, I think thank you for sharing this information. I think it's a great education and community benefit. And really, the more you know, the more we can get through this together. So thank you.
Very good. Okay, well, thanks for tuning in and listening to us on our East County Movers, Shakers, and Newsmakers event virtually for East County Magazine.